Welcome. My name is Peter Strong and I specialize in mindfulness therapy, which I offer online via Skype for the treatment of anxiety and depression, addictions, and many other common psychological, emotional problems that really respond well to mindfulness training. So if you're looking for an online therapist to provide you with effective techniques for working with your anxiety and reducing it and eliminating your anxiety, then please reach out to me. Simply email me, tell me more about yourself and the particular problems that you're struggling with, and ask any questions you may have about online mindfulness therapy. So, seeing a therapist online is a very good choice for most people, especially if you use Skype so that you can see each other. Then really there's no difference at all in my experience between online therapy or seeing a therapist in person. So how do we apply mindfulness to working with anxiety? Well, there are lots of different aspects to this, but the first most important thing to understand is that anxiety is a habit. It's something that got established early on in your life and it became habitual, which means that it operates out of consciousness. So the first aspect of recovery from any kind of anxiety condition is developing more consciousness. And that is exactly what mindfulness is all about. It's developing an awakened consciousness to see your anxiety clearly as it is, without reacting to it, without becoming lost in the constellation of reactive thoughts and beliefs and emotional reactions that make up the structure of anxiety. We practice seeing all of these components clearly and without becoming unconscious, without becoming reactive. When you react, you essentially lose consciousness and you become controlled by that habit reaction. So this is the first necessary condition for healing anxiety, developing more consciousness. Many people, and I'm sure you will agree, are very aware of their anxiety. They know that it's there. It's ruining their life. It causes tremendous suffering. So you know it's there. That is awareness. But it's not quite the same as consciousness, and certainly not the same as mindful consciousness. So the kind of awareness that we are more used to is really simply the awareness that accompanies those habitual reactions. In Buddhist psychology, we call these habitual reactions sankharas. They're part of what makes up each moment of our experience. And the problem is that we become identified with these sankharas, these mental objects, these mental formations. And when that happens, we become reactive. We become prisoners of those mental formations. So the first necessary condition for healing is to separate out from the reactive habits and instead becoming and establishing yourself as the observer of these mental formations. So as the observer, you are observing these mental objects that arise in the mind, thoughts, emotions, beliefs, etc. But the observer is not the objects that it observes. It is something quite different within you. And that kind of consciousness is what we're talking about when we are training in mindfulness. So mindful consciousness is not conditioned, it's not reactive, it's not limited. It's basically best described as being like a space that contains those mental objects. But it is not the same as the mental objects. It is quite different. So when we are working mindfully with our anxiety, we are learning to develop this internal space as our primary identity. That's who you really are. That's your true self, the bigger mind. The contents, the habit formations that make up the anxiety, that's the little mind, the little self. And so by training with the anxiety, by actually focusing mindfulness attention on your anxiety, you begin to develop this different side of yourself, this unconditioned true self, which is simply the process of observing itself, observing these thoughts and emotions in the mind. That is what begins to allow healing to occur. If you become reactive, that simply feeds the anxiety and it prevents healing from occurring. So reactivity inhibits healing. But non-reactivity, which is that unconditioned consciousness that is your true self, that does not feed the anxiety habit, and it allows it to heal. The second part of mindfulness training, and I will teach you how to do this, is to develop compassion and friendliness towards your anxiety and other emotions that make up that anxiety. The friendliness component is an essential ingredient of mindfulness. If it does not have compassion or love within it, then it is not mindfulness. It may be awareness, but it's certainly not mindfulness. Mindfulness must have this added quality of friendliness and compassion. So we learn to cultivate compassion towards our anxiety. And of course, that is precisely what the anxiety or fear needs. It needs to reconnect with that bigger part of you that can provide love and compassion. Anxiety typically gets started when those mental formations become disconnected from your true self, when they become isolated and cut off from your true self. That's what allows them to proliferate and what prevents them from healing. But when you bring them into the true self and start to take care of them, then they start to heal. So we build this relationship. This is part of mindfulness training. And the basic process by which we do this is mindfulness meditation. So this is a different kind of meditation than you may be familiar with. But mindfulness meditation, or vipassana as it's called in Buddhism, is really a process of meditating on the mind. It's developing this relationship of the observer or true self, seeing the content of mind, which is where the suffering occurs. And it's seeing the suffering, awakening to the suffering, and responding in an active way with love and compassion, which heals that suffering. So we meditate on our emotions. We go and search for our anxiety. We review all of the triggers that trigger that anxiety. And we meditate on those triggers. It might be past events, it may be future events that we're worried about. It could be just what you're experiencing right now inside yourself as a felt sense of something that's suffering, that's out of balance, that's not healing, that's somehow disjointed, that's dissonant. That suffering, or dukkha as it's called in Pali, the language of the Buddha. So we meditate on our emotions in order to develop this healing relationship of mindfulness, compassion, and consciousness. It's very effective indeed when you start to develop this internal compassion and internal acceptance. Very, very effective, and considerably more effective than reaching for medications. Medications will do nothing whatsoever to promote healing. They simply mask symptoms. Well, that's not enough. That's not good enough. So we need to start taking charge of our anxiety. We need to take responsibility for healing it. Medications will not heal anything. So if this interests you, if you are interested in talking to an online therapist who specializes in mindfulness therapy for anxiety, then do please reach out to me by email. Go to my website, learn more about mindfulness therapy in general for treating anxiety, and then email me, and let's schedule a Skype therapy session. You will see very quickly just how powerful mindfulness therapy and training can be for healing anxiety and other forms of emotional suffering. So if you want to get started with the mindfulness approach rather than medications, please contact me. Thank you.